Hello, I am Dr. Pascal TROTTA, a radiologist and former intern at the hospitals of Paris, as well as a naturopathic physician, acupuncturist, and nutritionist. And I will talk to you about prostate cancer in this dual capacity. So this video is of interest to those who have been diagnosed with prostate cancer or who have had a blood test, particularly the PSA, and find that their PSA is above 4, and they are offered a whole series of examinations, including a prostate biopsy. And even if you have had a prostate biopsy, this video is for you. It will interest you because I will provide you with another perspective, my perspective as a radiologist and naturopathic physician on prostate cancer. So prostate cancer does not affect all men, but it affects a larger part of the population, and it is a cancer that has been increasing in recent years, not least because a screening policy has been proposed, systematically conducting blood tests for men starting at age 50 and measuring a prostate-specific antigen known as PSA, and which is normally below 4 and above 4. When you have had this blood test and you go to see your doctor, the doctor, generally concerned, will refer you to a neurologist or a radiologist to perform a prostate biopsy. So right away I say no. Absolutely do not perform a prostate biopsy immediately, because this PSA is not a relatively reliable marker for prostate cancer. Certainly the more cancerous cells you have in the prostate, the higher this marker increases. But this is not systematic. And then it should be noted that PSA is dependent on prostate volume. In short, to summarize, at 20 years old, your prostate weighs 20 grams. At 40 years old, she weighs 40 grams. At 60 years old, 60 grams. At 80 years old, 80 grams. In short, your prostate enlarges as you get older, as you age. So, if at 60 years old you had a blood test and your PSA is at 6, which is above the so-called normal value of 4, well, in fact, this PSA is dependent on the volume of your prostate, and you multiply the weight of the prostate by 1.2 to get the upper PSA level. If you have a prostate weighing 60 grams, you are allowed to have a PSA level up to 7, so forget about 4. So 7, your PSA is essentially dependent on the volume of your prostate. That is why when you have a blood test done, if your PSA is above 4, you undergo a prostate ultrasound. It's that simple. There is no need to perform it via endorectal approach, which can be painful and dangerous for some people. You conduct a suprapubic ultrasound of the bladder when full, along with the prostate, and then you will urinate. The radiologist, if he has done his job well, checks if the bladder empties completely after urination. And the radiologist will reliably measure the volume and thus the weight of your prostate with 3 measurements. So, 1. Get an ultrasound after any PSA test to see if this PSA is related to the volume of your prostate. Imagine that you have a PSA of 8 and your prostate weighs 40 grams. At that moment, yes, you may have small cancerous cells in the prostate. But that does not mean that you have prostate cancer in any way at all. As with breast cancer, medical professionals confuse cancer cells and cancer diseases. In fact, they are actually not the same at all. Cancer is characterized by cancerous cells that develop in an organ in a chaotic and rapid manner, leading to a doubling of these cells very quickly, even quadrupling. It is an exponential growth. Once these cells have crossed the small vessels, they migrate to distant organs from the primary organ. Cancerous disease refers to a primary cancer in an organ, such as the prostate, with small cancer cells that migrate into the blood towards the bones, because prostate cancer migrates and causes bone metastases. That is what cancerous disease is. But that doesn't mean that if you have a high PSA, you have cancer at all. No, no, and no. To determine if you have cancer, it is necessary to consistently monitor your PSA levels over time. So, when you have a high PSA, do not rush into a biopsy first and instead opt for monitoring. I will therefore talk to you about biopsy and then about monitoring. First, It's important to understand what a biopsy is. It involves passing through the rectum, where the fecal matter is located, with many bacteria. And the radiologist or urologist, using a small medical gun, will puncture your prostate through the rectum area. First, it hurts. Second, you systematically cause an infection in your prostate because you understand that if you put a bit of feces into your prostate, excuse my vulgarity, but that's what happens when it passes through the rectum. This is therefore the least sterile place in the human body, and we are going to insert into your prostate with this needle, a needle that will bring bacteria from your stool, even if you have emptied the rectum. It is never clean, and thus you systematically induce prostatitis. And then you will artificially and falsely increase the PSA. So 1, you are causing prostatitis. 2, it hurts. 3, it's an aggression. Personally, I would never have a prostate biopsy because I find it an unnecessarily aggressive procedure. First, you need to check your PSA and only perform the biopsy if the PSA truly increases significantly. And you will see that this PSA, which increases very significantly and very rapidly, concerns only 10% or even 5% of people who have a high PSA. In fact, aggressive prostate cancer, like breast cancer, affects only a tiny minority of patients, less than 10%. Why would 90% of men undergo risky procedures such as biopsy or surgery when they do not have cancerous diseases, but just small cancerous cells in the prostate? Another very important piece of information that will help you understand: you take 100 people who have died in a car accident. You have 100 corpses. You will analyze the prostate of these 100 corpses. Well, you have 100 corpses aged from 20 to 100 years. Well, you will see that the presence of cancer cells in the prostate evolves with age. Very few cancer cells at 20 years old in the prostate. Almost 100% of cancer cells in the prostate of men who are 100 years old and who did not die from their prostate but from a car accident. So one might wonder, as with the breast, whether as we age, the cells in the prostate are likely to become cancerous. Perhaps. But this is not cancerous disease. They will not migrate elsewhere. This is what is called cancer cells in the prostate. And when a biopsy is performed and cancerous cells are found in the prostate, immediately you will be labeled prostate cancer. That is false. Forget that. You just have cancer cells in the prostate. And what is common sense? It is to wait and see if these cancer cells will multiply or not. Whether they multiply quickly or not, whether they multiply exponentially or not. And how do we do that? Well, 3 months later, you take another blood test, a new PSA, the marker. And what if this marker, which was at 8, remains at 8? Well, 3 months later, we do another check, etc. But if it goes from 8 to 16, then yes, we will opt for a more aggressive approach. But if it remains stable, we will monitor it closely. In monitoring, there are 2 types of surveillance. There is passive monitoring, where I do nothing and do not change my lifestyle. This is not what I recommend to you. The second type of monitoring is active surveillance. You will become an active participant in your health. You are indeed the one who will change your lifestyle, your way of eating, and in fact, try to reduce these small cancerous cells. And what should you do if you have been found to have a PSA between, I would say, 4 and 10, or even between 4 and 20? Well, you will have a PSA check after 3 months, but during these 3 months, you will stop the risk factors for prostate cancer. These are indeed cow's dairy products because they contain pesticides that can resemble hormones. You will significantly reduce sugar because cancer cells feed solely on sugar. You will increase antioxidants, particularly red, green, and yellow lycopenes, especially in tomatoes. You will take pumpkin seeds, which are known to have benefits for effectively reducing prostate congestion, and suitable supplements to limit prostate growth. Take vitamin C, regulate your intestines by taking Producta and Omidocta, thereby increasing your intestinal flora, reducing inflammation, and properly nourishing your mucosa. Reduce stress in your life, be less sedentary and more, etc. In short, everything needed to reduce the cancerous terrain. That is active surveillance. And then you can do acupuncture to treat stress. You can take natural therapies such as herbal medicine, homeopathy, etc., which will help you during these 3 months. And after 3 months, you have a checkup. If the PSA is stable or decreases, that's good. It is not cancer. If the PSA increases, it may be cancer. If it increases slightly, we can wait another 3 months to conduct another check, always maintaining this active surveillance. The solution is not that difficult. If you are passive, you will trust medicine. They will perform the biopsy and then they will offer you aggressive treatments. What are these aggressive treatments? Well, to treat prostate cancer, conventional medicine proposes surgery as the first treatment. It is a radical prostatectomy, usually performed via the suprapubic approach. The entire prostate is removed. This is not at all the same procedure as adenoma surgery, where the surgeon accesses through the penis and scrapes inside the prostate to widen the channel through which the urethra passes, which is often narrowed by the prostate adenoma. This surgery has no drawbacks on virility, etc. Meanwhile, cancerous prostate surgery via the suspensory route has 2 risks: incontinence and impotence. Be careful. Think twice before undergoing prostate surgery, or even 3 times, because incontinence and impotence are potential risks of this invasive procedure. The second therapy, radiation therapy, can be performed rectally by implanting needles and rhodium into the prostate. It is a more targeted therapy than external beam radiotherapy, which can lead to, and I have seen this and treated patients for it, extremely significant inflammation of the rectal mucosa. I have treated patients who had bowel movements 30 to 40 times a day due to poor radiation of the prostate that had severely damaged the rectum. So be careful, radiotherapy also has side effects. It burns the organs around the prostate. It can lead to rectal strictures, even rectal inflammations and proctitis, which can cause recurrent diarrhea and even rectal incontinence. This is not trivial. So there is the third therapy, which is hormone therapy. Similar to breast cancer, it is proposed to block hormones because it is believed that these hormones are responsible for prostate cancer. Let's think about it for a moment. If hormones are the cause of prostate cancer, at what age do we have the most testosterone? Is it at 80 years old or at 20 years old? It is at 20 years old that we have the most testosterone. This is where libido is at its peak. This is also where there is the least prostate cancer. Therefore, linking hormone levels to the risk of prostate cancer does not seem valid to me at 100%. Because at 60 years old and at 80 years old, that is when you have the least hormones and testosterone, and that is when there is the most prostate cancer. So I believe that prostate cancer is more due to aging and external environmental factors than to internal hormones. So some doctors, the oncologists, suggest blocking testosterone and provide anti-hormonal treatment. The problem is that this will lead to early andropause, and men undergoing this hormone therapy often experience breast growth, a condition known as gynecomastia, their fat distribution taking on a feminine pattern, and they see their virility completely diminish, with a total absence of libido, to the point that many men stop this hormone therapy for prostate cancer, just as many women stop hormone therapy for breast cancer. So the therapies proposed to treat prostate cancer are quite aggressive. We cut, it's surgery. We burn, that's radiotherapy. We chemically block hormones, that's hormone therapy, for instance. And if there are metastases, well then, it's chemotherapy to try to fight against the bone metastases. And at that point, it is entirely legitimate. When breast cancer has invaded the bones, aggressive treatments are necessary to match the aggression and aggressiveness of these cancer cells. But I remind you, prostate cancer with metastases is a very small minority of prostate problems. So, alongside these aggressive treatments, you have natural treatments. And so, you can very well inquire and find out if, instead of or alongside these aggressive treatments, you could receive gentler treatments, such as apophytosis or endotherapy, like scalar waves, hydrogen, vitamin C, etc., as well as certain supplements that have their value in the treatment of prostate cancer. Anything is possible. Each person requires a specific treatment. Treatments must be personalized. So, the message of this video is very important. If you have an increase in your PSA level, do not rush into a biopsy that could lead you to aggressive treatments that may harm you. Take the time to have checkups. Engage in active monitoring. Educate yourself about natural medicine. There are therapies available. There are specialized care centers for this. And these natural therapies work very well alongside conventional medicine. This is what is called integrative medicine. There is not just conventional medicine to treat prostate issues. You are primarily the number one actor in your health by reflecting on why you have these cancerous cells. Are these cancer cells cancer? Do I need to have monitoring? Yes. Passive? No. Active? Yes. And how can I treat myself differently to avoid the side effects of aggressive treatments? Thank you.